In today's health alert, a dangerous fungal infection spreading quickly across the U.S. New data from the CDC shows 33 cases of candida auris have been reported in Michigan. Other states like California, New York, and Florida seeing hundreds of cases. Our chief health editor, Dr. Partha Nandi, joins us now to tell us how this could impact our health. And Dr. Nandi, the fungal infections, not only spreading, but becoming harder to treat.
Yeah, it's concerning, right? The new data, to me, is concerning because the cases of the potential fungus candida auris have jumped 200%. The first cases were reported back in 2016 and were initially confined to New York City and certain areas in Chicago. But now, candida auris is found in more than half of the U.S. So what is the fungus and how did it get here? Well, candida auris is a yeast, and there are 4 different strains. It was first identified in Asia in 2009. Now, all 4 strains can be found here in the U.S., most likely due to international travel, and we take it all across. Now, in the CDC report, researchers analyzed health department data. They looked for folks who were infected with the fungus, as well as those who were colonized. Now, colonized means people who carry the fungus on their skin but are not sickened by it. After crunching the numbers, data shows that the infection cases increased from 53 in 2016 to 1,471 in 2021, a big jump. And cases of folks colonized with the fungus tripled from 20 to 21, increasing to 4,441. I'm sorry, 4,041, sorry.
So why is this fungal infection dangerous? How does it spread?
And that's the question, right? So candida auris is not dangerous to most healthy folks. It's more likely to affect people who have serious medical problems, those whose immune systems have been compromised by other illnesses, and people who need medical devices like breathing tubes and catheters. They're vulnerable. And for those who are high risk, if an infection reaches the blood, brain, or lungs, more than 1 in 3 patients will die. That's because it's becoming more and more resistant to treatment. And the number of cases resistant to medication has tripled. And we're talking about this. As for how it's transmitted, unfortunately, candida auris spreads easily from person to person. And for those who are colonized, and they don't know that they're carriers unless they are tested. Also, the fungus can survive for months on surfaces like walls, beddings, and chairs, and it's hard to kill, and only certain disinfectants work against it. So it can cause outbreaks, especially in long-term care facilities, and this is concerning. But there have been large outbreaks that have been controlled, so it's not a hopeless situation, but one that we have to be aware of and take prevention methods to control the spread once the fungus has been identified. So again, not all hope is lost. This is to increase the awareness so we can do something about it.
Yeah, it's scary, you know.
It is. Whenever you think about fungus and blood, people get scared, but I think we can control it.
Okay, that sounds good. Thank you, Doc.
My
Appreciate
pleasure.
your time. And if you have a health question for the good doctor, you can email him at drnandi@askdrnandi.com or send it to us on Facebook or Twitter. We'll get it right to him.
So no Last of Us just yet.
Let's hope.